ladies and gentlemen. I'm Dave Crouch, and this is the legislative update presented each month by the Williamson, Inc., our county chamber of commerce, and we're glad to have you all here. Got a lively crowd here at Columbia State this morning, and wasn't sure I was going to get them quieted down for this morning. But we're glad to have you. Glad you're all enjoying the visit this morning. We glad to have the folks live with us on WCTV and also on WAKM. I hope that everybody enjoys the content of our show this morning. We have two of our state legislative delegation with us this morning, Senator Jack Johnson, our state majority leader, and Representative Sam Whitson from the 65th District here in Williamson County. We're missing Glenn Casta, who is traveling out of the country this week, and Brandon Ogles is suffering with apparently a rotator cuff injury that he's having some work done on this morning. So we, I think, have two.
When you're in politics, Dave, you get your arm twisted a lot, and I think that's what happened. True story. I got the text from Brandon this morning. He said, "I'm going to get an MRI, and I am in a bad mood." So.
And I mentioned that to somebody else, and they said, "Brandon always looks like he's in a bad mood." But we're sorry he's not able to be with us this morning. We'll get him one of these days and get him back up here and find out what's going on. We've finished the 2019 session of the state legislature. The media has been interested in almost everything besides the actual nuts and bolts and meat of the session. And so I want to focus on that this morning, what you actually got done, because I know you all are proud of a lot of the work you got done, and we want to try to not only highlight some of that, but understand better, what's behind the work that you did. Sam, I'm going to start with you because I've got 30 pages of notes from Jack, and I only got one page from you. But
okay, no Senate jokes then, I'm sorry. They do work hard over in the Senate, though. He said, "Thank goodness for the Senate."
No harder than you do, I don't think. There were several things, though, that Sam, you carried in the House, and two or three of them I want to specifically discuss. Katie Beckett bill, we talked about a little bit last month, so let's don't spend too much time on that. But in a nutshell, what does that do? And
thank you. And there's two ladies here also that advocated, two pediatricians who came to my office quite a bit to make sure we were on the right track, and there's several other stakeholders in here. The Katie Beckett waiver, and we couldn't have done it, though. It was a team effort. Couldn't have done it without Jack, his leadership over in the Senate, and because it had a pretty high fiscal note. It was $27 million. At first, we thought it was going to be $47 million, and so we worked to get that down. And basically what the Katie Beckett waiver is, in the 80s, President Reagan was trying to reform the Medicaid program, and he discovered that Medicaid would not cover children with severe disabilities and complex medical issues, would not cover their health care costs if they were treated at home at a much lower cost. It would only cover it if they were in an institution or a hospital. So over the years it's developed, and our state, basically our policy is if a child has a very complex, and we're talking about, there's probably about 400 children across the state, if they have one of these medical conditions where that their chances of survival to 18 could be in doubt, but they require constant care. If their parents made too much money, they would not be covered by Medicaid. Now, so what it was doing, families were, to get around that, they would get divorced or give up custody of their child, or they quit their job, and then they would get the coverage. So fundamentally, morally, that was not right. And it was not we felt like the state was letting these families down to stay together to take care of these children who have did not cause this. It was, and when you met these children and the parents, it was heartbreaking. And so what we did, we worked with TennCare and the Department of Intellectual and Developmental Disabilities and the governor's office in the Senate, and we came up with legislation that would cover these children, and also additional others, those with severe disabilities, but not requiring as much care. So we allocated $27 million. There's a 2-to-1 federal match on this. And so the governor signed it last week. We'll do more of a formal signing ceremony later on. And I tell you, it was a team effort. We could not have done it with stakeholders. We could not have done it with the disability community, the families. I think we had over 70 co-sponsors just in the House alone. And it was, and I got to give the TennCare committee chairman, Matthew Hill, a lot of credit, because when they first approached me to carry this, I was looking at maybe doing a pilot program, and we decided we're going to go all whole hog. We were going to get the whole thing done and get all the kids covered. And so I was very grateful for that. And like I said, it was a team effort, not just one person. And I'm just very proud of our state, our General Assembly, to do this. And I tell you, it was, I don't care if I do anything else up there the rest of the time I'm there. I'm just was very proud and humbled to be a small part of this.
That sounds like a very worthy bill. Jack, you got anything to add?
Well, Sam was really the tip of the spear on this and worked very hard to get it done and showed a lot of leadership with it. And to put this into perspective, the average expense for these kids is $150,000 per year. So now some might be a little lower, some might be more, but that's the average. That was the number that was used in the fiscal note. So we came up with a cost of it. So I don't care. Most Williamson Countyans, even though we're the wealthiest county in the state, $150,000 a year medical bill would be financially devastating to most every family, I would say. So. So very, very happy that we were able to get it done. One of the reasons we were able to get it done, though, is because our state is in the best fiscal condition it's ever been in, and we did have some surplus dollars because of our fiscal conservative nature, and we're very deliberate about taking on new programs and new expenses. There was very, very little question that this was well worth doing and worth allocating that money. And the other key point, which Sam mentioned, but I'll reiterate, is the federal drawdown. It is a 2-to-1, match. So it's actually 70 some odd million dollars, I think, is what the actual number is, but it's a $27 million commitment at the state level for both Part A and Part B. So anyway, very, very, very excited that we were able to get this done.
Great. Sam, we'll start off on this one with you again. Natchez Trace Bridge. Tell us what's going on there.
Again, Jack and I were approached by families who were impacted by this. There's the, and I appreciate the coverage in the newspaper. That made a big difference. 32 folks have committed suicide out there, and we determined it was a health hazard for our state. And again, it's federal property, so we had very little that we could do as a state on this. And so what we did a joint resolution asking the federal government to stand up and do something about this. We don't know what the answer will be, but it's anything that can mitigate the danger out there. If you look at the rail, it's only about this tall. And also someone else brought up to me, it's not only the suicide issue that we deal with, but also there's vandalism where people are throwing things off the bridge, and that's the sheriff's department. And actually, Sheriff Long and Sheriff Rhodes, when they have a sheriff's patrol car not on call, they park out there. Because that has made a difference. And so we appreciate what the county has done on that, but we can only do so much as a state. So we petitioned the federal government, the National Park Service, to get involved and do something to mitigate that danger out there. And it is a health hazard. And I think former Senator Frisk did an article in National Review or Atlantic or one of the magazines about that. And I don't know, it's a beautiful structure, but they call it a suicide magnet. And so, again, we carried that total support in the House and Senate on that one.
Jack, do you
I think that's about it. And again, it's, a lot of folks, we get lots of calls and emails about it. It is a federal facility. The Natchez Trace Parkway, as you know, is a federal park. And so I think we're taking the appropriate action here to petition them and have a partnership with them to address it.
And I'd like to compliment Mark Green when he was running for Congress. I called him and said, this is a potential issue you need to know about. He immediately got in his car and he did what in the Army we call a route recon, or a site recon, and went out there and took a look at it. And he's been really involved in this also, and I appreciate his office working with us and getting that pushing in the federal level.
When are we going to be able to not have to go through emissions testings in Williamson County?
Well, a good question. Yesterday, we had a meeting down at the state with the TDEC, Department of Environment and Conservation, and we passed a bill to get us out of this requirement to have your car tested. So it's a lot of wickets you have to go through this. This is the federal government we're dealing with and the state government. So I got an update yesterday, and I'll try to remember the dates and everything. Basically, the state has done the preliminary work, and they've done the testing data and stuff, and we are below the standard. So we're looking good as far as the pollutant level that we put into the air. So we're below the requirement to have to do this. The next step is to get it through the state process with the Attorney General and some other groups, and we anticipate that should be done sometime this fall, and it will put us in a position to make an application to the EPA sometime January or next spring to get all the paperwork done, and we got to make sure it's done correctly. Now, the federal government, looking at past history, after we make an application, if they take no action on it, it becomes approved after 6 months. But we think they will take a look at it and get it approved sooner than that. But then again, it takes another 12 months for them to go through the rest of the process. So we're talking about the maximum. If we get it submitted next spring, federal government has basically up to 18 months to give us final approval. It'll impact Middle Tennessee and Hamilton County. So looking at the timeline, we're talking maybe 2021 before we can get rid of that requirement and move forward on that. It's kind of funny that the folks from Murray County and Marshall County, they drive through here, but they're not required to have that. And you look at the traffic on I-65 and you wonder why us folks in Williamson County have to do it. So, but then again, the county would have to approve that. The biggest issue that I'm concerned about, and they say they think they can fix it, is finding a contractor that will continue to provide that service up to the end, because basically you're signing up for a business that's going out of business and finding workers and stuff to do that. So that may be the challenge toward the end, but I think we're moving in the right direction, and I appreciate the actions that the General Assembly took to remove this burden off our citizens.
One other kind of nuts and bolts issue, and that's cockfighting. Sam, I understand you were heavily involved in a bill involving dog and cockfighting.
Not heavily involved in cockfighting. You're heavily involved in legislation regarding
legislation. Yes. Jack didn't warn me. There's two things you don't touch up there: is annexation and cockfighting. And I found out the hard way this session, right? And so I was approached, and it was a good bill. I mean, it looked good when it left the House, and but anyway, we had legislation to make possession of paraphernalia associated with dog fighting and cockfighting illegal. Right now, there is no law to own the spurs for the cockfighting or the paraphernalia used in dog fighting. And but my friends and colleagues, who I have great respect for from East Tennessee, had some issues with the cockfighting. And the bottom line is there's too much money involved in cockfighting. I mean, people don't realize illegal gambling is involved and drug use is involved in cockfighting. Not just the fighting with the animals, the animal cruelty and such. So, but we did. We got the bill passed and got signed by the governor on cockfighting. We're going to work on the dog fighting later on, but for a while there, I thought Jack may have to come and look for me buried in Cocke County. But it was an interesting experience.
I was going to send Brandon to come look for you.
He may be there right now.
One other, I guess you could call it a nuts and bolts bill. Jack, you can weigh in if you want to. Historic tax credits, though, that's something that I know we were looking for as a chamber. Did that happen? And
It did not, no, and
Fiscal.
yeah, it's a fiscal note, and I don't remember how much it is.
It was
It's-
over 5 million.
Yeah,
I think.
But here's the good news: is it's got momentum, and I think there's going to be a big push for it this coming year. This would basically it would provide some tax credits for historic preservation, and obviously something that's very important to us here in Williamson County, and really we're kind of the model when you look at Williamson County, and thanks to the Heritage Foundation and other groups that have worked so hard to preserve some of our very important historic assets here in Williamson County. And what has that done? It's really helped with our economy, right? Because people want to come here and they want to. It really improves your quality of life, and so it could be and will be probably beneficial to Williamson County. But the cow's kind of out of the barn already for us, and we've demonstrated that. And so other counties and other cities across the state are looking. And not just at Williamson County, but others across the state who have been successful with this historic preservation. But what it basically comes down to is in many instances, if not most, it's not economically viable to go in and take an older structure and retrofit it and bring it up to standards and where it can be used and satisfy today's code requirements and different types of things. It's more economically viable to just destroy the facility and rebuild. And then, of course, you lose the historic character of what you're trying to preserve. So, again, the budget process, which we'll probably talk more about, we talked about Katie Beckett. It's just like you do with your family budget. We sit down and we have X number of dollars. We don't borrow money in Tennessee. It's the third year in a row now. We've not acquired any new debt in Tennessee. We've cut taxes again, and our revenues continue to go up. And that's a good thing, but they are limited. And we have one-time money, and we have recurring dollars, and we have to prioritize that. And Katie Beckett was obviously a top priority for this year, and we got that done. But it meant some other things that we would really like to see done as well had to kind of take a back seat. So no promises, Dave, but I think that the historic tax credit legislation, there's real momentum for that. I think the governor believes in it. He obviously lives in Williamson County, and he's seen how successful we've been, and he wants to be able to use that as a best practice in other parts of the state where they're perhaps slightly more economically challenged and be able to create some economic development through historic preservation in other areas.
Good deal. Great. Now let's take a more 30,000-foot view of things and the budget. Apparently, was controversy this year in getting a budget passed. What's the difference? You had a lot of new faces up there. Did they just not know what was going on and didn't know how to challenge the process, or why did we have such a smooth budget passing process?
I'll tell you, for me, and this was my 13th year up there, first as a majority leader of the Senate, and first time being the sponsor of our $38 billion state budget. So it's a little bit intimidating. And you're right, we had a brand new governor, and I think I've mentioned in past roundtables that when you look at the House and the Senate, every single leadership position in the House and the Senate had a new person in that position, except for the Lieutenant Governor, who's Speaker of the Senate, and that's Randy McNally. Every other leadership position in the House and Senate had new people, but they weren't necessarily new to the process. They were just in a new capacity. I've been in the Senate for a few years, and so I've watched and I've been a part of this process. And when I ran for majority leader, one of the things I campaigned on with my colleagues is that here's some ideas I have about how we can make this process better and more smooth. My counterpart in the House Majority Leader, is William Lamberth. And William and I have been friends. He's from Sumner County, and he is a super guy, and we've been friends for a long time. And so I was very excited to get to work. So he is the House sponsor of the budget. I'm the Senate sponsor of the budget because we're sponsors of all the governor's legislation, including the budget. And so he and I went into this with a really, really good working relationship, and we kind of sat down and said, let's think about this process. And basically the way it works is that the House has priorities, the Senate has priorities, but we have to come together and we have to pass the same budget. It has to be identical in both chambers. And so we have to reconcile those differences and the differences in priorities. And so we were able to do that, and the House kind of goes on its track, the Senate goes on its track, but there comes a point at which time we have to get together, leadership in the House and the Senate, and sit down and look at each other's priorities. What we actually did this year was a bit different, is the House went through the entire process and passed a full, complete budget on the House floor. And the Senate, we kept ours in the Senate Finance Committee. It's really getting into the weeds, but you guys might appreciate some of this. That's why you're here. And so we were then able to see the House priorities. We had passed our budget out of the Senate Finance Committee, and that's when we got together with our respective leadership teams, and we're able to say, okay, I know this is important to y'all, this is important to us. And I'm not going to say there wasn't some headbutting. There was a little bit of debate and negotiation in that. But at the end of the day, we were able to come to an agreement and get it passed. And for the first time, I believe, in over 10 years, the state budget received a unanimous vote in the Senate when it got to the floor, and a unanimous vote in the House. And you had a brand new governor doing it too. So we're very proud of that, and it didn't get a lot of media attention. I think it should have gotten more, but that I think is a demonstration, and not to pick on Washington, but I'm going to pick on Washington a little bit. When you look at the gridlock and dysfunction that exists in Washington, they haven't even passed a budget in I don't know how many years. They're operating off continuing resolutions. But we, as your elected representatives, we came together with a budget and we passed it, and I think we were good stewards of your tax dollars. And so it did go a lot smoother than it has in recent years. And that's not a criticism of anybody that was involved in the process previously. It was just, I think, a deliberate mentality that we're going to come in and we're going to work together.
And, you know, despite all the recent news and everything, we do have to give credit also, a lot of credit to our House leadership that made that happen, okay? I mean, that was a whole different ball game than previous years. When we were in there at 10 o'clock, 11 o'clock at night, waiting for the Senate to compromise and go back and forth. And that was an interesting process, but it went great. And also in that budget, I'm not sure if folks know, but there was $700,000 for Columbia State to start planning for a new building. And so that's good news for our community, and so there was some good stuff in that budget.
Dr. Lampley, let's give you a hand.
Yeah. And Dave, if I could, just a couple of high points on that. You may be heading this direction anyway, but we made the largest single contribution to our state's rainy day fund in the history of the state, $225 million, which gets us to $1.1 billion. That's in our savings account. We have a very good economy right now. Our revenues are strong. What should you do when that is the case? You should be saving for a rainy day. And we call it a rainy day fund for that very reason. Our state's budget year over year grew 1.1%. 1.1%.
And one national magazine just rated us as the most financially secure state in the nation.
U.S. News and World Report said we're the most fiscally stable state in the union.
That's very good, very good. Healthcare was attracted several bills, and in addition to the Katie Beckett waiver, the Medicaid block grant, though, there was a lot of discussion about that a while back, and I believe that passed. Explain how that works, Jack.
Yeah, so when you look at our Medicaid program, which we call TennCare, and it is a Medicaid waiver program, so we have applied to Medicaid to be able to operate our program in a specific way. So, but we're still very heavily constrained by federal regulations that are consistent across all 50 states. So what the federal government is saying, because they supply, for the most part, it's 2 to 1. The state puts in $1 and the federal government puts in 2, and that's from, it was passed in the 1960s, how it has operated. But we have the same requirements that California has, or Wyoming has, or Massachusetts has in terms of how we operate that, and not every state is the same. And so we would like more flexibility in using those healthcare dollars to be able to take care of Tennesseans. We have unique problems in Tennessee. We can brag a lot about our fiscal stability. We don't rate very high whenever it comes to diabetes and obesity and smoking. So we have challenges there that we need to address. We're not a terribly healthy state. We're improving, but we got a long way to go in that regard. And of course, the least healthy among us are those who are the most economically disadvantaged and the most likely to be on TennCare. Not universal, but broad strokes here. So what the block grant legislation simply says is that we instruct TennCare to go to CMS in Washington, that's Centers for Medicaid and Medicare Services, and say, we would like for you to just block grant those dollars to the state. We still have to use them for health care for the poor, but we would like to be able to tailor a program that's more suited for Tennesseans and be less constrained by federal regulations. Because we believe, and our TennCare Bureau, the people who are in this day in and day out, tell us that we could generate significant savings by doing some very simple things. And when I say savings, that doesn't mean money that we can go take to build roads. That means it generates savings that we can use to take care of more people, either to provide better or more care to people in Tennessee. And so all this means is that TennCare now will apply to the Center for Medicaid Services for a block grant to come back to the state. Now, we put a number of parameters on there because people have some very legitimate concerns, which is to say, well, right now, we basically get those dollars on a capitated rate. So if our TennCare eligible population goes up, we get more money. Now, right now, Tennessee has a very strong economy. Quick digression here, Dave. If you just saw, the Department of Labor and Workforce Development just released that in April, the unemployment rate dropped in 94 out of 95 counties in Tennessee. That's never happened before. And the only one that didn't drop was Murray County, and it stayed the same. So the unemployment rate is at an all-time low in Tennessee. Interestingly, Williamson County has an unemployment rate of 1.9%. Now, economists will tell you that they consider full employment at a 3% unemployment rate. We're at 1.9 in Williamson County. Now, back to the TennCare. So we're in a really good shape right now. Is that always going to be the case? No, of course not. We will have another recession. It will happen, and our unemployment rate will go up. Well, guess what happens to the TennCare rolls whenever that happens? They go up as well, right? So we don't want a static dollar amount. If our TennCare rolls go up 5% or 10%, then we want to maintain that capitated rate. So that's one example of a guardrail we put on there that we want the flexibility, but we want TennCare, or Medicaid rather, to continue to honor what they've done before, and that is to provide a capitated rate. So, and then you've got healthcare inflation and some other things that go in there. You have certain types of medicine that can come out that are very expensive, but can provide life-saving treatment to some people, and those types of extenuating circumstances need to be applied for as well. So, so anyway, it's an application process. Doesn't mean it's going to happen. There's a negotiation that takes place. We work very closely with our TennCare folks who, again, are doing this day in and day out to make sure that we can get some flexibility without being penalized with those dollars coming from the federal government.
I couldn't find it in my notes. I've been over here thumbing through them trying to find it. But a couple of years ago, Governor Haslam made a very huge effort to try to expand Medicaid to cover many of the uninsured people in the state. And somewhere in the notes I was reading last night, I noticed that there was, I believe it was $225 million for uninsured, to expand uninsured coverage. Are you familiar with what I'm talking about?
It's probably money that's going to our healthcare centers and county health clinics across the state, which are kind of on the front lines of and I'm not going to commit to that specific dollar amount without it in front of me, but yes, Governor Lee put in his budget a significant amount of money to go out to those who deliver this frontline primary health care, particularly in rural areas where there is less access to health care.
So is that somewhat designed to fill that gap?
Well, I think it's a combination of things, and it kind of ties into this discussion about the block grants for Medicaid. One of the arguments that are part of the debate we had when we were considering Governor Haslam's Insure Tennessee proposal And I give the governor a lot of credit because he worked very hard and diligently to negotiate with CMS that if we did expand our Medicaid population, that we would get some of that additional flexibility. And one of the arguments that came from those who opposed the effort to pass Insure Tennessee was, well, why can't we get some of that same flexibility with the existing TennCare dollars, not just the expansion population? Because we think that if we are able to generate some of these savings and efficiency, we will be able to deliver more and better care to more people. So let's do that, see where we are before we sign on for a potentially, $500 million a year additional expenditure in state dollars for the Medicaid expansion. That's part of it. And then the other part of it is, again, to work with our, FHQs, federally qualified healthcare, whatever the acronym.
You're doing great.
Yeah, thanks, Sam. Let's go back to talking about transportation here. But the last thing I want to say about this is Governor Lee and the General Assembly, but Governor Lee is very, very committed to improving healthcare access and quality in the state of Tennessee. And he is putting together, in the process now, a task force to meet stakeholders from across the state. I was at an event the other evening, a great event for Vanderbilt Ingram Cancer Center, which does amazing work, right here in Middle Tennessee. And we want them to be a part of this task force as well, to really take a hard look at our healthcare delivery system in Tennessee and how we can improve that moving forward. And I'm very excited about that group getting together and coming back with some very significant recommendations.
Could add, and we do have a potential healthcare crisis coming up also for the state, and it's dealing with our aging population and the Alzheimer's challenge that we have. And statistics shows 1 in 3 Tennesseans will be faced with that, whether they're a family member or actually have the disease. So this year we passed and created an Alzheimer's Advisory Council under the Aging and Disability Commission, and so that will help us anticipate the cost of this to the state as we go down. And that was one of the big bills we passed that did not get a lot of attention, but it really will make an impact in the future, how we control those costs and how we can fight this deadly disease that will impact just about everybody in this room.
Noticed also that you expanded the state employee insurance coverage to include proton therapy for cancer patients where it's warranted. Jack, we've now got a proton therapy facility here in Franklin, which if you haven't seen it, it's a really impressive.
It's an amazing facility. There's one in Knoxville, and we now have one right here in Franklin, just down the road from us. And I passed it driving in this morning. And then there's St. Jude has one as well for pediatric, which is somewhat different. The coverage for that is more broad. So proton therapy is a state-of-the-art type of cancer treatment to where traditional treatment is IMRT, and there was a time I could tell you what that stood for, but not this morning. IMRT, which is delivery of radiation. Think of shooting with a shotgun versus a rifle, and versus proton therapy, where they can go in with certain types of cancer, and it has less side effects, it damages fewer cells in surrounding areas, I guess. Anyway, very, very exciting, state-of-the-art stuff for cancer treatment. But the FDA, in some instances, still considers this to be, and for some treatments, for some types of cancer, experimental type treatment. And so we have this rub between insurance companies that don't want to pay for certain types of treatment. They'll pay for some and not others. And so this is one of those instances where the state got involved with our insurance plan. That's the largest insurance plan in the state, but it's the state employee insurance plan. So it's teachers and county employees and state employees. And we worked out an agreement to cover this type of treatment for more indications of cancer, and really kind of getting ahead of FDA and whoever else decides what's experimental and what's not. But it's a good bill. It's very complicated in terms of how you do it and insurance reimbursement and that type of thing. But hopefully it will move the needle. And this type of treatment will continue to gain favor and access, or become, not considered to be experimental. I'm not a doctor. That's a very difficult question to answer. So,
But I agree with Jack.
It's, at least on that. At least on that. You know, I promised to ask you about things that you like to talk about, and some of the things that you probably don't. But Sam's getting nervous. But there was a bill passed to. I'm not sure how to say this, actually. I'm sitting here looking at it and can't read it, but I'll just read it. Trigger the restoration of Tennessee's abortion laws prior to the Roe versus Wade ruling. Explain that. What are we doing? What are we trying to do?
Well, over on the House side, we passed two bills, actually. One was the heartbeat bill, and I think that was done more as a response to what they did in Virginia and New York, that abortions up to the last, my understanding. But also, Susan Lynn carried a bill that would be I think a trigger bill that if Roe v. Wade was ever overturned, the state would comply. Basically, legislation's there already in place, and that passed also and went to the House or to the Senate. And understand it passed in the Senate, and so. That would avoid the lawsuits and the cost of the other bill, and but we see other states are moving in that direction, and so that's why it passed in the House. And in the Senate, again, Susan Lynn brought that legislation, and it's called trigger bill. And so the Tennessee Right to Life supported that bill. They did not support the other bill, and that's a fine organization, and they were worried about the cost of litigation on the other one.
Yeah, and of course you're hearing in the news now a lot of different states are passing legislation relative to abortion. The trigger bill, Sam is exactly right. That's a pretty simple bill. It just says, prior to Roe and 73, I believe is when that decision came down from the Supreme Court, Tennessee had laws on the books restricting abortion. And so what the trigger bill just simply says is that if Roe v. Wade were to be overturned by the Supreme Court, that we would go back to the laws we had on the books prior to 73. They're still on the books. They're just not valid because of Roe v. Wade. And so there was some question about if it was overturned, would the General Assembly have to take action or not? So this clarifies that. The other bill, which I'm a co-sponsor of, is the heartbeat bill, would say, and you're seeing this passed in some other states, is that once a heartbeat is detected, then abortion is prohibited. And I very much support that conceptually. The issue is, though, every single state that's passed a heartbeat bill, it has been enjoined or it's been invalidated by the courts. And some would argue that really that's the intent of that type of legislation, is to get a bill or get an action of the courts on the way to the Supreme Court in the event that they should decide to revisit this particular issue. The House passed a heartbeat bill. The Senate looked at it, studied it very thoroughly, and just felt, well, if we're going to do this, and it will. I mean, there's no probably to it. It'll be enjoined immediately, probably, and it will get us on the path to the Supreme Court with these other states. And that's a worthy, in my view, that's a worthy thing to do. And we want Tennessee to be a leader in this. Tennessee is an overwhelmingly pro-life state, so I have no issue with us putting our flag in the ground and making that stand and having legislation headed to the Supreme Court for review should they decide to take it up. The issue the Senate had is with respect to the House, we didn't feel like that the language in there was as tight as it could have been, and there were some last-minute efforts to try to make sure we had the most defensible language possible for judicial review in the legislation when we begin that track. So there's a study committee that is set to meet in August, and where members of the House, Senate, we're going to bring in constitutional scholars, attorneys from across the country to come in and sit down, spend about 2 days looking at that and really nailing down that language, and then bring it back next year. So that's where we stand. There were those two bills which did receive some media attention. A lot of it was somewhat misinformed, but that happens. Yep. But I fully expect we'll be back in January with a heartbeat bill that we can pass.
Very good, very good. Opioids, a huge problem in Tennessee as well as around the country. And I think everybody's looking for ways to help deal with that problem. I noticed one of the bills strengthened the penalties for fentanyl use or sale. The one that kind of attracted my attention, though, is a bill that defines alternative pain treatments, and to include chiropractic care, physical therapy, acupuncture, and other treatments that relieve pain without the use of opioids. What does that do, just to define alternative? Jack, you're
That's what it does.
On a roll.
I'm not on the health committee. I do remember this legislation. I'll speak to it as best as I can. The opioid problem is multifaceted, and it is a big problem, and hundreds of people are dying every day from opiate overdose. And it's part of it is a prescribing problem, that there are some providers out there that are over-prescribing, and that's not a criticism of our healthcare delivery system. I mean, but they're like anything. There are bad actors in every barrel, and so we have to try to rein that in. You know, you go in for a toothache and you get a 30-day supply of opioids. I mean, that's you can't do that in some instances. So it's a prescribing problem. Obviously, it's a trafficking problem, and so part of what. And I believe that legislation was intending to do is to make sure that those in the medical community know that there are alternatives that can be used for treatment of pain other than just simply writing a prescription for these very, very powerful drugs that are highly addictive and can be fatal.
And if I recall, there was some pushback on our legislation we did pass that we may have gone too far on tying the hands of the doctors to get the medication for those who really need it. I mean, one size does not fit all on that, and I think we may have tweaked that also. If I'm
yeah,
not
because
mistaken.
you may recall last year in the 2018 session, and even prior to that, under Governor Haslam, we passed some pretty significant legislation that did restrict, how much you can prescribe and that type of thing. Now, you go in for major back surgery. It's a totally different deal. And we had providers coming back saying, well, you said I could only write a 5-day prescription, and it's Wednesday, and so that prescription is going to expire on Sunday or whatever, and then they can't get a refill on it. And so we tweaked some of those things. So again, those who legitimately need the drug can get it, but not maybe some of those who an alternative would work better for them.
Court process, judicial process. Would y'all like to just do a broad brush on this, or dig into some details? Let me just read down some of the bullet points that, and the notes I'm looking at came from this, I'll just go ahead and say it, the Senate Republican caucus. Just a list of all the things that you all dealt with. By the way, how many bills got passed this session? Do we know?
I know that there was 1,500 put on note or filed in the House, and of course, we have a 15 bill limit. I was trying to find that the other day, but I owe you that answer. But
it's usually around 500 or so. I mean, that's 1,500 to 2,000 get filed. Maybe about 500 of those get passed. And sometimes people say, well, why are you putting 500 new laws on the books? Well, no, that's not. I mean, it might be changing an existing law or taking something out of the code or whatever else. There's a lot of housekeeping that goes on from year
And
to
also,
year.
we have laws where if you're in an unincorporated area of a county and an establishment wants to have a liquor's license, we have to approve each one in the House. So that takes up a lot of legislation too. So, I mean, there's a lot of small things, but I would say there's probably about 150 to 100 major pieces of legislation that impacts across the state. Wouldn't it fair?
Yeah.
Lots of, I would say, housekeeping type things. You streamline the death penalty process to basically bypass the appeals court and go straight to the Supreme Court. In an effort, appears to take some of the time out of the process for the victims. The truth in sentencing, just to make sure violent offenders actually serve the sentence. I can't believe you had to actually pass a bill to do that, but apparently you did. Community oversight boards kind of putting the guardrails around what the city of Nashville was trying to do with the police oversight board. Safe baby courts, adding programs to the state court process, total of 12 safe baby courts, just to deal with babies under 3 years old in the court system. Sounds like a lot of, I mean, could that not be consolidated under something else? Never mind. I'm just rattling down through here, but you
got that list from the Senate, though, right?
I did.
Okay.
I did. Your list was much shorter. But probably should have stuck to yours.
Let's start with the House.
Because I'm getting in the weeds myself. But quite a few budget tweaks, I would say, for the Department of Corrections. Salary increases for corrections officers, almost $25 million for hepatitis C treatment for the inmates.
And I think a lot of people, they got a lot of, I won't say press the wrong way, because if we did not do that, and I think the treatment for that treatment runs around $50,000 to $60,000, and there's like maybe 5,000 inmates that have that, and they keep getting it. And if we had not done that, we would probably be facing a federal lawsuit where it would end up costing us over $100 million. So I think it's a proactive approach to that issue. There was some criticism, why are you doing this for prisoners when we're not helping kids over this other? But it was really in the long term to save the state money and the litigation costs. So I think the governor took a right approach on that.
Okay. Professional privilege tax. I noticed that you eliminate the professional privilege tax. People like me pay $400 a year to the state of Tennessee to be a financial advisor.
I try to make it $600. Okay, no, no, I was kidding. But you eliminate it. You're fine.
I'm just getting on. This is my personal pulpit here, okay? But you eliminated it for accountants, architects, athlete agents, audiologists, chiropractors, dentists, engineers, landscape architects, optometrists, pharmacists, podiatrists, psychologists, real estate brokers, speech pathologists, can't talk plain, and veterinarians. Why didn't you eliminate it for financial advisors?
Well, here's why, Dave.
By the way, there are about 40 of us that didn't get our category eliminated.
Well, no, that's not true. There were 22 that were subject to the tax. We eliminated 15, and that I believe leaves 7 that we're still paying. So the professional privilege tax has been a burr under a lot of people's saddles for many years. It's basically if you have a professional license in Tennessee, we make you pay this tax. Now the rationale early on when this tax was put into place was that the people whose professions are paying this tax don't have to collect sales tax. So the other thing we could do, Dave, is not charge you the $400, but make you collect 9.75% sales tax on all the massive amounts of money you make. So
watch out now.
$600.
$600. So backstory on this, and I'll try not to get too far into the weeds. So, we authorized the Department of Revenue to begin collecting in a more assertive manner online sales transactions. This is something that we've struggled with, for many years, because you go down here to Joanne's gift shop and you buy a trinket and you're going to pay 9.75% sales tax. But you order the same trinket on Amazon. Well, it's not fair because we've worked a deal out with Amazon, but you order it from some online thing, you don't pay the sales tax. Well, that's unfair to the brick and mortar, place here. Anyway, that generated $44 million in additional revenue. It was our posture in the Senate, particularly, and the House agreed, is that, okay, that's somewhat of a windfall of money. We're not going to just go and spend that. We're going to offset that with some tax cuts. And so the number one place we wanted to go after all the taxes we've cut in recent years, the inheritance tax, the hall income tax, the gift tax, is we want to go after this professional privilege tax because it's somewhat, in my view, inherently unfair that you have to pay a tax in order to practice your profession. Well, where do you do it? To give you an idea, we wanted to cut $25 million. We could have reduced the tax from $400 to $300 on everyone who pays it, and the fiscal note was $25 million. Or we could eliminate 15 professions, including speech pathologists, who make an average of like $31,000 a year, okay? But they have to pay the $400 tax. Now you have doctors and lawyers who might make $500,000 a year, and they're paying the $400 tax. And so there's no good way to do it. You're going to make someone mad, but we decided to eliminate the 15 professions that we viewed were and we used data to determine this, were the lower, the least compensated of that. Here's the good news, though, Dave. We set back $25 million that we're just setting on. We didn't recognize it, so we can come back and try to address, some of the other professions. The number one profession that pays the tax and generates the most revenue off the professional privilege tax are financial advisors.
Yeah,
so
we'll be the last one.
So you are last on the list, Dave. You are last on the list. So
You need a better lobbyist, too.
And full disclosure, we also left in attorneys, and I'm married to one, so I write that check every year too. So.
All right, I'd love to spend some time on the lemonade stand bill, the bingo bill. We now don't have to have a business license to have a lemonade stand if you're under 18. Are we going to have a referendum on bingo? You familiar with that bill?
Yeah, there was some conversation about it. Who all was here during Rocky Top? Remembers the Rocky Top scandal in Tennessee? So there's some pretty hard feelings on that. I don't know, but the argument is there are some legitimate charitable organizations out there who could do it responsibly and generate money for their charities. But we had a really bad experience. If those of you who may not remember Rocky Top back in the 70s, 80s or whatever, it was a huge scandal. People went to prison, judges, members of the General Assembly, because they were illegally selling bingo licenses. So there's a pretty bad taste in a lot of people's mouths about bingo.
And there are procedures, though, for charitable organizations to have raffles and such, and going through the Secretary of State approves that, and they take a close look at it to make sure it's done correctly.
This says that it will allow voters to amend the Constitution to allow bingo for certain charitable organizations. So stay tuned for the referendum coming around to legalize bingo. I know you would probably like to spend more time on this stuff, but you'd rather get around to education and education savings accounts and things like that. We've covered it ad nauseum. I'm not going to get too deep into it again, but is there anything you would like to share about the ESA legislation and what we should expect from that?
I've been waiting for 3 years for you to ask me an Army question, Dave. It passed.
It passed. The governor signed it, and I'm very excited about it. I think everybody knows my position on it. It's the right thing to do. It's going to help 15,000 kids and that are trapped in failing schools, and I'm proud that Tennessee took a stand finally after many efforts. Governor Lee showed real leadership in that. It's something he campaigned on. He's very passionate about. And so it is very much a pilot. We have 1 million kids in public schools across the state of Tennessee. This will affect, when it's fully implemented, 15,000. That's 1.5% of the student population in the 2 districts that have the highest concentration of failing schools. So it's in place. It's going to be implemented, and with very strict requirements to measure results, which is what we want to do, to see how it works and how effective it is.
And it provided some great drama in the House during the vote. That was an interesting day. I was supposed to go speak to a group scheduled months in advance, and I'm glad I held off.
in our circles here, you would think everybody in the state was opposed to that bill. But you mentioned one time that maybe the polls showed otherwise, Jack.
Oh, it has enormous support in Tennessee when it's accurately described and when you ask it in an honest way, which is if you poll it and say, should parents of children who are zoned to failing schools be allowed to use the money that's allocated for their education and go to another school? Should they be allowed to do that? And that's what the ESA bill does. Yes, it's off the charts in terms of support. So I'm very, very satisfied about it. I respect those who disagree, but we're just going to have to agree to disagree. But to me, this is one of the. It's not a silver bullet. It's not a panacea, but it is part of an overall reform effort, building on what we've done for the last 8 years in the state of Tennessee. And again, it's going to help 15,000 kids be able to pursue the American dream, and I'm going to support that.
Moving on, we'll agree to disagree with each other on some of these things. But one of the governor's initiatives was to expand the career technical education opportunities out there in particularly rural disadvantaged places. And I know you all both worked with the Fairview High School program that Columbia State has out there for the mechatronics students. What has changed as a result of the governor's initiative?
I understand he has increased the number of opportunities for dual credit, 2 to 4, and in fact had a meeting last week with the county officials that administers that program here in the county and the principal at Fairview High School, and we're going to go forward working with the higher education folks to see how we can do that better as this pilot program goes forward. So we're getting the governor's staff engaged and the appropriate departments that maybe Fairview will be the standard going forward across the state.
Good. I told you we were going to talk about transportation. Criminal justice appears to be somewhat put on the docket for next year as a priority. In a few minor changes this year, but anything to expect out of next year's session?
Well, I would say we did some fairly significant things. You're right. I think the bulk of it will probably happen. It's a complex issue, but we allocated more money for the ankle bracelets, the monitoring devices for nonviolent offenders to be able to not have to be incarcerated. We passed some fairly significant sentencing reform relative to different types of crimes, and so there were some steps taken. But I do expect Governor Lee to come back with a more comprehensive look after working and talking with the Judicial Conference, the DA's Conference, public defenders, and so forth, Bar Association, to come back. A lot of stakeholders with regards to that, and I think we'll have more soon.
I just realized we're 3 minutes away from the show being over, and there's a glare on the clock, so I wasn't watching it quite as closely as I usually do. I wanted to get into the transportation projects. Sam, 30 seconds.
Real quick. 3-year plan just came out last month, and got some significant projects on that. And when a project gets placed on a 3-year plan, that means it's going to be completed. So we have basically from Duplex Road, widening US 31, all the way from Duplex Road in Spring Hill up to 840. And then also, and from 840 up to Mac Hatcher there by the Kroger Target area. So that's that's on the books and is going to get done. Also, one of the most significant ones that construction will start late this year or early next year is a new interchange in Spring Hill. That will take a lot of traffic off. And while we, in the city of Spring Hill has really stood up and made that happen, the leadership down there took a $25 million federal grant, gave it to the state. The state and Spring Hill is working together on that. Mac Hatcher, additional 2 lanes from 96 East over to US 31 there, again, by the Kroger and Target area. Mac Hatcher is moving from West Haven over to Hillsborough Road. That's a big project. And the project, of course, 31 from Moores Lane North is on track to be completed in 2022.
I'd love to spend some more time, but our time is over, and we're not going to be able to talk about the legalization of March Madness gambling and that sort of thing, but maybe we can get into that next year. Really appreciate you all being here and participating. It's a great forum for the business community to get to know you all and what's going on with the state legislature, and we just appreciate your participation every year.
And we appreciate you doing this for our community, Dave, and Williamson Inc. And
Thanks to
Vander-
all the people who put this together. It's a great opportunity for us.
There are usually, and we don't have time this morning. I'm sorry. We've just want to wrap up here and just say thanks to all the corporate sponsors, AT&T, Vanderbilt, the coffee folks from Community Coffee. Columbia State has a wonderful facility, and Dr. Lampley, we appreciate you hosting us here. Creed Henderson and the WCTV crew make us look good every month. And Tom Lawrence, we appreciate you making sure it goes out on WAKM. Chamber staff does a lot of work behind the scenes to make this happen, led by Matt Largent and Kel McDowell back there. Nancy Conway always is a resource that we use a lot. And so we appreciate all you all do, and just appreciate you all being here, and hope you'll be back next month. Thank you very much.